Fatty liver disease, also known as hepatic steatosis or steatotic liver disease, is a common and increasingly prevalent condition where excess fat builds up in the liver cells, affecting millions worldwide. This condition is highly prevalent, especially in Western countries, and is often closely linked to metabolic syndrome, obesity, type 2 diabetes, high blood pressure, high cholesterol, and excessive alcohol consumption. There are two main types: metabolic dysfunction-associated steatotic liver disease, or MASLD, formerly known as non-alcoholic fatty liver disease, or NAFLD, and alcoholic liver disease, known as ALD. MASLD is strongly associated with metabolic risk factors such as obesity, type 2 diabetes, high blood pressure, high cholesterol, high triglycerides, and insulin resistance. ALD, on the other hand, is directly caused by heavy and prolonged alcohol consumption, which leads to fat accumulation in the liver. Often, fatty liver disease presents with no noticeable symptoms at all, particularly during its early stages, making it a silent condition. However, as the condition progresses over time, several signs and symptoms may start to manifest, including some that are visible right on the face and can serve as early warnings. It's important to note that these facial changes alone don't definitively confirm fatty liver disease, as other conditions like allergies or thyroid issues can cause similar symptoms. However, if several of these signs appear together persistently, it definitely warrants a prompt medical evaluation to rule out or confirm fatty liver disease. Let's explore 3 key potential facial changes that could indicate the body is dealing with fatty liver disease and signal the need for attention. First, facial puffiness and swelling, particularly around the eyes and cheeks, can be a significant warning sign of underlying liver issues. In advanced liver disease, the liver's ability to produce essential proteins like albumin, which are crucial for maintaining proper fluid balance and preventing leakage into tissues, becomes impaired. This impairment leads to fluid accumulation, known as edema, in facial tissues, causing the face to appear noticeably puffy and swollen, especially prominent around the eyes and cheeks. Persistent facial puffiness, particularly without an obvious cause like allergies, seasonal changes, or poor sleep, should definitely prompt a medical evaluation for possible liver concerns. Second, various forms of skin discoloration on the face and neck can appear and serve as important indicators. Jaundice causes the skin and especially the whites of the eyes to turn a distinctive yellow due to a buildup of bilirubin, the yellow-orange pigment from red blood cell breakdown. When the liver is not functioning correctly, it cannot process and excrete bilirubin effectively, leading to its harmful accumulation throughout the body and visible yellowing. Jaundice often appears first and most noticeably in the face and eyes before it spreads to other parts of the body like the skin and mucous membranes. Another discoloration is darkened skin and neck creases, known as acanthosis nigricans, which is often linked to insulin resistance commonly seen in fatty liver disease. Impaired liver function can also lead to persistent dark circles under the eyes, hyperpigmentation, or dusky patches due to toxin buildup and poor blood filtration. Additionally, spider angiomas, which are small, visible blood vessels resembling spider webs or threads, can appear on the face as an early sign of cirrhosis from fatty liver progression. Third, various skin irritation and changes on the face can occur and become more prominent with fatty liver disease. Fatty liver disease can cause persistent skin itching, including on the face, due to an excess of bile salts circulating in the bloodstream that irritate the skin. Some individuals may experience aggravating skin problems like acne breakouts, excessive oiliness especially around the chin and jawline, and stubborn rashes around the mouth area. Rosacea, characterized by persistent facial redness, visible small blood vessels, and sometimes small red bumps, can also be more common or severe in people with fatty liver disease. The skin on the face may also become irritated, itchy, excessively dry, flaky, or even swollen due to these liver-related imbalances. Diagnosis typically involves a thorough medical history review, physical examination, blood tests including liver function tests, and imaging studies like ultrasound, CT scan, or MRI, with biopsy if needed. Management primarily focuses on lifestyle modifications, including adopting a healthy diet low in saturated fats and sugars, achieving gradual weight loss, and engaging in regular exercise. Additionally, controlling blood sugar levels for diabetes, managing high cholesterol and triglycerides, and completely avoiding alcohol are all crucial steps in treatment. While fatty liver disease often progresses silently without obvious signs, paying close attention to subtle facial changes can provide valuable clues for early detection. Early diagnosis combined with committed lifestyle changes can significantly improve liver health, reverse damage, and prevent progression to more severe conditions like cirrhosis.